One of the main decisions you need to make during open enrollment is the medical plan that best suits you and your family. In this video, we'll go through the different options available. You should also review the open enrollment book for more information about the plan design options. The first thing you'll need to decide is which plan design best suits your needs. The State Employee Health Plan offers 3 designs known as Plans A, B, and C. Once you pick a plan design, you should pick a vendor. There are 4 vendors to choose from: Blue Cross Blue Shield of Kansas, Preferred Health Systems, Coventry Healthcare, and UMR. You'll need to review the provider networks of the vendors to determine which ones have the doctors and hospitals that you use. Finally, review the premiums to decide which plan provides the coverage you need at the cost that best suits your budget. All of the plans are known as Preferred Provider Organizations, or PPOs. PPOs use a network of providers. The providers within the network agree to accept the health plan allowed charge as payment in full. However, providers outside the network do not agree to accept the plan's allowed charge, and they may bill you for amounts above and beyond what the plan allows. In some cases, you may encounter a non-network provider even when you go to a network facility. Some common examples include pathologists, emergency room providers, anesthesiologists, radiologists, and laboratory technicians. In a medical emergency, if you use a network hospital and encounter one of these providers, all of the plans except Blue Cross will pay the providers as if they were a network provider. This reduces your responsibility for deductibles and coinsurance on those providers. You will be responsible for any amounts above what the plan allows. All of the health plans encourage prevention and wellness. The goal is to maintain or improve your health and to identify any health issues early so treatment can be provided. When you use a network provider, the health plan pays for your services in full. Immunizations are covered at 100%. That includes flu shots provided by network providers, as well as shingles vaccinations for members over age 60. When you use a network provider, the plan covers in full the cost of an annual physical exam, immunizations, vision and hearing exams, bone density screening, mammograms, and colonoscopies. Now let's take a look at specifics of the 3 medical plan options. For people enrolled in Plan A who go to see a network provider, preventive care services are covered in full. Office visits with a primary care provider are subject to a $20 copay. All other providers will be considered specialists and are subject to a $40 copay. The deductible applies to services other than preventive care or office visits. The deductible applies once per year and is $150 per person, up to a maximum of $300 for the family. After you've paid the deductible, you and the plan share in the cost of your care. This is called coinsurance. The plan pays 80% of your covered healthcare expenses. You pay the other 20%. Throughout the year, you will pay your share of coinsurance up to a maximum of $1,200 per person and $2,400 for a family. After that, the plan pays covered services at 100% for the rest of the calendar year. New to Plan A this year is the addition of the Quest Lab Card benefit. We encourage you to seek care from a network primary care provider. Those include providers in general practice, family practice, internal medicine, pediatrics, geriatrics, and physician extenders such as physician assistants and advanced registered nurse practitioners. You are not required to designate a primary care provider, and a member may use more than one type of primary care provider for care. But we encourage each member to have a primary care provider who helps direct their care. The medical plans are preferred provider organizations, therefore referrals are not required when seeking services. Any provider may use the Quest Lab service by calling Quest to pick up the sample. You and your provider will decide whether or not to do so. When you have covered outpatient lab work performed and billed by Quest, the plan pays 100% of the cost of the service. Lab work not performed and billed by Quest is covered, but subject to the plan deductibles and coinsurance. For people enrolled in Plan B, there are no changes to the plan this year. Preventive care is covered at 100%. Office visits for adults will require a $20 copay for primary care and $40 for specialists. For dependent children age 18 and under, the office visit copay has been reduced to $10 for primary care and $25 for specialists. Plan B does not have a deductible when you use a network provider. Services other than preventive care and office visits are subject to coinsurance. The plan pays 70% and you pay 30%. The maximum coinsurance you'll pay during the year is $2,200 per person or $4,400 for a family. After the coinsurance maximum is met, the plan pays 100% for the rest of the calendar year. Plan B also includes the Quest Lab Card benefit. Whether you're in Plan A or Plan B, if you choose to use a non-network provider, you'll be responsible for the first $500 of covered services as a deductible. A maximum of 3 deductibles will apply for a family. After the deductible, you will pay 50% coinsurance up to a maximum of $3,650 for a single member and $7,300 for a family. You are also responsible for any excess charges above what the plan allows. Preventive care is not covered with non-network providers. Plan C is a different kind of coverage. It includes a qualified high-deductible health plan and a health savings account. The Internal Revenue Service has set out guidelines on who can have a health savings account. You may not enroll in this plan if you or anyone you cover is enrolled in Medicare, if you're covered by another plan that is not a qualified high-deductible health plan, if you or your spouse have a traditional flexible spending account, or if, within the last 3 months, you received or were eligible to receive Veterans Affairs medical services. If you select Plan C, you'll be responsible for paying the first $1,500 of network medical and prescription drug expenses if you have single coverage, and the first $3,000 if you have family coverage. Funds in your health savings account may be used to pay this deductible. After you have met the deductible, the plan pays 80% for medical services and you pay 20% of the allowed charge. Once your deductibles plus your copays reach the out-of-pocket maximum of $3,000 for a single plan and $6,000 for family coverage, eligible medical and drug claims are paid at 100% for the rest of the calendar year when you use network providers. Preventive care services are not subject to the deductibles and are paid at 100% when received from a network provider. If you go to a non-network provider, you'll have a deductible of $2,000 for single coverage and $4,000 for a family. Once the deductible has been satisfied, you'll pay 50% coinsurance until you reach the out-of-pocket maximum of $3,650 for single coverage and $7,300 for a family. After that, eligible claims are paid at 100% of the allowed charge for the rest of the calendar year. The health savings account portion of Plan C is a bank account that you own to fund your out-of-pocket and non-covered health care costs. If you enroll in Plan C, the state will contribute to your HSA at the rate of $37.50 per pay period for single coverage and $56.25 for family coverage. You will be required to contribute $25 per pay period. You may elect to contribute more if you wish on either a pre-tax or post-tax basis. Each of the 3 vendors offering Plan C has a banking partner for the health savings account. The investment opportunities and fees will vary by the bank. Additional information about the HSA is available on our website. If you enroll in Plan C, you'll be responsible for opening the health savings account. This can be done online or by printing out the form and submitting it to the bank. You are responsible for documenting the use of the funds. To summarize, the State Employee Health Plan offers 3 plan designs known as Plans A, B, and C. All 3 plans use Preferred Provider Organizations, or PPOs, which means you get the most value out of the plan when you use network providers. Plan A requires you to pay an annual deductible and coinsurance for most services. Plan B has no deductible and lower office visit copays for children under age 18. Plan C is a qualified high-deductible plan with a health savings account that the employer makes regular contributions into on your behalf. Be sure to review your enrollment book for more details about the 3 health plans. You can also get more information on the KHPA website.